Okay, so now we're going to start talking about some infection control. I want to talk about medical asepsis versus surgical asepsis. Medical asepsis is reducing the growth and spread of microorganisms. So there are some things that we do that aren't sterile technique, but they do reduce the number of microorganisms and reduce the spread. It's also called clean technique. So medical asepsis is clean technique. Okay. This is stuff you know. This is stuff you learned in LPN school. This is stuff you learned in paramedic school. We're going to go back over it because some of the things that you're not using all the time tend to kind of slip your mind. So hand hygiene, soap and water, 20 seconds, don't touch the handles. That's pretty easy. If soap and water is not available and the hands are not visibly soiled, then alcohol-based products work. Rub till dry. There are a few organisms that it's not as effective for. One of the major ones you need to be aware of is C. diff. If a patient has C. diff, you have to use soap and water every single time because alcohol-based products are not effective against spores. Other basic hygiene measures like covering coughs and sneezes, being 3 feet from people that are coughing. That's kind of funny in this atmosphere now, but typically for droplets, we want to be at least 3 feet away. Hair should be short or pulled back when working in healthcare setting. Hair needs to be washed frequently enough to be clean. Nails short, clean. No acrylics or gels. Bacteria can get in the spaces underneath those acrylic or gel nails and multiply, and so that can be an infection risk. And we need to remove jewelry to wash our hands. Protective clothing, we're going to go into PPE a little bit more later. PPE is a lot more familiar than it was 2 years ago for most of us, but make sure you're wearing appropriate PPE. General environment things for medical asepsis, these are just some general rules. And the number one thing that I see people doing that's a violation of infection control is putting linens on the floor. So we should not put anything on the floor with not clean, not dirty, no linens, clothes, things like that. We want to avoid the floor. Now, in an emergency situation, we're just tossing things wherever they go, right? But in a typical situation, we want to take a linen bag in with us, put the linens into the bag as we go, take a belongings bag, put the patient belongings back in them. We want to avoid throwing things on the floor. We want to avoid shaking linens as we're removing them and bagging them, because whatever's on them, we're just flinging it through the air. We want to clean from cleanest to dirtiest. That's when we're bathing a patient. That's when we're doing wound care. Just a general principle is clean from cleanest to dirtiest. That's probably something your mom taught you when she taught you to bathe yourself, right? Soiled linens and trash should be bagged before removing from the room. So we should not be carrying linens down the hall to go into the linen room. They need to be bagged before being removed from the room. Lab specimens should be transported in biohazard bags. If I have a specimen to collect, I try to take a bio bag with me. And if you try to label your container before you collect the specimen, then you don't have to handle it as much afterward. Liquids that are used for patient care need to be poured directly into the drain and avoid splashing. Body fluid should be flushed directly in, disposed of directly into a toilet at a level to avoid splashing. So we want to make sure that we are disposing of things correctly to avoid contamination. Okay, that's medical asepsis. It's a review. It's all things you know. We're going to move on to surgical asepsis in the next video.